Cancer is a complex group of diseases. There are many types of cancer. They all share one common trait. This trait is the uncontrolled growth of abnormal cells. These abnormal cells can invade and damage nearby tissues. Sometimes they spread to other parts of the body. This spread is called metastasis. Understanding the different types of cancer is crucial. It helps doctors diagnose and treat each case effectively. It also empowers individuals to be proactive about their health. Cancers are named based on where they originate. The name reflects the primary site of the tumor. For example, lung cancer starts in the lungs. Breast cancer starts in the breast. Sometimes the name also includes the specific cell type. A cancer's name can tell us about its behavior. It can also give us clues about how aggressive it might be. Knowing the type of cancer is essential. It helps doctors tailor treatment plans for each patient. Carcinomas are the most common type of cancer, accounting for about 80 to 90% of all cancer cases. They arise from epithelial cells, which are the cells that cover the inside and outside surfaces of the body. These cells line the surfaces of organs and body cavities, providing a protective barrier. There are different subtypes of carcinomas. These include several major types. Adenocarcinoma. This type starts in glandular tissues. These tissues secrete substances like mucus and digestive juices. Examples include breast, prostate, and colon cancer, which are among the most frequently diagnosed cancers. Basal cell carcinoma. This is the most common skin cancer, often caused by prolonged exposure to ultraviolet (UV) radiation. It originates in the basal cells of the epidermis, the outermost layer of the skin. Squamous cell carcinoma. This type also affects the skin and can be more aggressive than basal cell carcinoma. It starts in the squamous cells, which are flat cells on the skin surface and can also occur in other organs. Transitional cell carcinoma. This type affects the lining of the bladder, ureters, and urethra and is often linked to smoking and chemical exposure. Section 4. Sarcomas. Cancers of connective tissues. These are a group of cancers that arise from the connective tissues in the body. Sarcomas are less common than carcinomas, which are cancers that originate in epithelial cells. They originate in connective tissues, which include bones, muscles, fat, and blood vessels. These tissues support and connect other tissues in the body, playing a crucial role in maintaining structural integrity. Examples of sarcomas include osteosarcoma, which affects the bones, often in children and adolescents, causing pain and swelling. Leiomyosarcoma arises from smooth muscle tissue, found in organs like the uterus or digestive tract, and can be quite aggressive. Kaposi sarcoma is a rare cancer that causes lesions in the skin, lymph nodes, and mucous membranes, often appearing as purple spots. It is often associated with a weakened immune system, particularly in patients with HIV/AIDS or those undergoing immunosuppressive therapy. Section 5. Leukemias, cancers of the blood. Leukemias are a group of cancers that primarily affect the blood and bone marrow. Leukemias are cancers of the blood-forming cells. These cells are found in the bone marrow. Bone marrow is the spongy tissue inside bones. It is responsible for producing blood cells, including red blood cells, white blood cells, and platelets. In leukemia, abnormal white blood cells multiply uncontrollably. They crowd out healthy blood cells. This can lead to problems with fighting infections, clotting blood, and carrying oxygen. The overproduction of these abnormal cells disrupts the normal balance and function of the blood. There are 4 common types of leukemia: acute myeloid leukemia, chronic myeloid leukemia, acute lymphocytic leukemia, and chronic lymphocytic leukemia. Each type has distinct characteristics and affects different populations. These types are classified based on the type of white blood cell affected and the speed of disease progression. Understanding these classifications helps in determining the most effective treatment options and prognosis for patients. Section 6. Learning more about cancer. Understanding the different types of cancer is essential. It helps us appreciate the complexity of these diseases. For comprehensive information on various cancers, their risk factors, symptoms, diagnosis, and treatment options, I recommend visiting the National Cancer Institute's website at www.cancer.gov. Knowledge is power. Stay informed and stay healthy.